Hey gang, it's Jenni Procopi here from chronicbabe.com, and it's another AWAP Wednesday. I don't know why I did that, but welcome to this week's video. It's December 1st, and I'm recording this video with a lot of emotion. So without further ado, let's dive in. Okay, it's December 1st, and 90% of the people who try to access HealthCare.gov, according to the government, are able to apply successfully for health insurance online. And that is great news. It's no secret to regular readers that I really wanted this legislation to pass. I wanted it to pass in its fullest form. It was kind of hacked up a bit by some parties, but I really wanted it. And not just because I want it for our country or our community of chronic babes, I wanted it for me because I need health insurance and I'm not married, I don't have a partner, I don't have those folks in my life who can give me insurance. I don't work full-time for a company, so I don't get insurance from an employer, and not having to pay for my own insurance with a bunch of chronic conditions has been really, really difficult. And I know I'm not alone in this. I know that probably most of you watching this are feeling the same pain. So I have to be honest with you and tell you I have not talked about this very much on the site because it's had such an intense impact on my life these past couple of months. So I want to talk to you for a minute about what my experience has been, and then I have a question for you this week. Okay, so I still believe in ObamaCare. I still believe in our country's ability to take care of its citizens. I still feel very strongly about those things. But what I'm about to tell you is not pretty. When ObamaCare was launched, when HealthCare.gov was launched is really what I should say, on October 1st, I decided to wait a couple weeks, let the dust settle, not jump into the website right away. Around October 15th, I started my application process. The online application process was extremely confusing to me. As a self-employed person, it's really difficult to figure out what they mean by how you report your income. So that I had a really tough time with it. And to be honest with you, I made a mistake. I reported the wrong income number, which I would guess would be a pretty common mistake for people who are self-employed or who have changed jobs in the year or don't know what their income's going to be like next year, because mine kind of roller coasters a little bit as a self-employed freelancer. That's the norm. So I made a mistake. And also that was at the time when I would go on the website and it would crash on me every 5 seconds and none of the pages would load and I had to fill out the same forms over and over again. So I think that part of the fact that I made the mistake came from the stress of the process. I mean, it took me 3 hours to fill out my initial application. I've had friends since then who said it has taken them 15 minutes. So I don't know if it's just me. I don't think it was. I think it was the website for the most part. And that was just the first step. That was just the first. So then multiple steps later, I went to town meetings. I spoke to my alderman's office. I stood in line at the alderman's office. I went to a local hospital that said they were hiring 20 certified application counselors, also known as navigators, also known as healthcare. I don't know what the hell else they're calling them, to be honest with you. I've heard so many different terms, even from the people who do that job themselves. At the alderman's office where people were lining up to sign up for healthcare, I asked one of the certified application counselors and she corrected me and said, I'm a navigator. And I said, what's the difference? And she said, I don't know, but we all trained together and we all got the same certification. And it's crazy to me that people who work in the system don't even know what their title is or don't know whose titles mean what. That's nuts to me. And so that was step 2, was all this research. And then, so I went to this hospital, had an appointment with a certified application counselor. They are only allowed to look at the application using Internet Explorer on an ancient PC, which meant she couldn't even access all the pages of the site that I could at home on my Mac. So I was not able to apply successfully that day. I went home for days afterward. I went through the website again and again, just trying to fix this one error. Because without fixing this error, I couldn't apply for healthcare insurance through HealthCare.gov. So weeks went by, I have IM'd the support team there. I have called them. I have emailed them. I've had my certified application counselor call them. I've left messages. Multiple times I've been told that my case has been escalated to the Advanced Resolution Center, and then weeks go by and I hear nothing, even though they say 2 to 5 business days. And then I say, can you define business days to me? And they say that's Monday to Friday. And I say, gee, that's funny. This website is a major catastrophe. I work on weekends sometimes. I don't want to, but I do when there's an emergency. Why aren't they working weekends? I've had a lot of these kinds of conversations. And after many conversations with supervisors at HealthCare.gov, I finally got on the phone today with someone who was supposedly at the Advanced Resolution Center who would fix my application and I could apply for health insurance and just be done 2 months after this thing launched. I get on the phone with this woman and she says, oh, we actually can't do that. We actually aren't able to do that for you. And I about lost it. I tried I really didn't, but in my head I lost it. Okay, so you can tell I'm pretty emotional about this, and I am, because I know that I'm not the only one facing this. I know there are so many people, thousands upon thousands upon thousands of people in this country who are struggling to get their health insurance set up, and this should not be so freaking hard. And on top of that, I have a ton of friends and people in my life who, as well-meaning as they are not facing this website and don't have to go through the process. And so they ask me ridiculous questions. Like, a friend of mine posted on Facebook in response to one of my things, I thought Illinois had a marketplace. Why don't you just do that? Well, buddy, my friend, person I love, I'm a healthcare expert, and you'd think I'd know if Illinois had its own marketplace and I would avoid going to HealthCare.gov. So no, Illinois doesn't have its own healthcare marketplace. I have to go to HealthCare.gov. And this seems like a small issue, but for someone like me who's like steeped in this stuff all day, every day, it's very frustrating. And it's very frustrating to me that people who aren't impacted by the website today, even though they are impacted by the healthcare law, whether they have to use the website or not, they haven't experienced it in such a visceral way as I have, as probably you have and other people have. It's so frustrating to me that smart, well-meaning friends who listen to NPR and consider themselves educated have like zero knowledge of the experience of so many of us in America that are going through this. So that's been like an extra layer of stress on top of this. So I haven't been able to apply. The website still doesn't work for me. The people at the top of the food chain that I can get in touch with at healthcare.gov say they can't help me. I have friends and family members who are asking me questions and kind of driving me nuts, and it's so frustrating because I just want their support. I just want them to hear me. Like, give me a minute to bitch. Just give me a minute to bitch. I won't take 10 minutes. Well, I might on this video. I won't take about a couple minutes. I just sometimes need to get it off my chest because it's so hard to deal with this every freaking day. So, AWAP Wednesday. You'll be watching this a couple days after I shot it, which is divine, giving me a chance to chill out a little bit. But my question today is not a question from a reader. It is a question from this chronic babe to you. My question to you, and I may be starting something here. We'll see. My question to you is, what has been your HealthCare.gov experience? I am dying to hear what's been happening. I want to know what you're experiencing. I want to hear all the stories. I want to hear all the details. If you've had a big success, I totally want to hear that. I need that positivity. If you've had a craptastic experience, I want to hear all the juicy details. And we're going to gather all this stuff up, and I'm going to send letters to everybody who serves me in government, from the alderman of my neighborhood all the way up to the president. I'm going to print everything out. I'm going to send them off. I know it probably won't make a huge difference, but I just feel like I got to do something, because it's crazy to me that we are a couple weeks from the deadline and I still can't get my healthcare coverage taken care of. And I've taken every step they've asked me to take. I've spent dozens of hours on the phone, online, in meetings, researching, trying to make this happen, and I can't make this happen. If I, who have resources and education and time, and English is my first language, and I have a support network, if I can't make that happen, think about all the people in this country who don't have all those things. Think about how hard it is for them. That just makes my head explode. So, my very, very sincere question for you today on this AWAP Wednesday is, what has been your experience? Please share it with me, and I will share it with the world. I hope this has been a great AWAP Wednesday for you. It's been a little cathartic for me, and I'm very excited to hear your stories. If you don't want me to share your name when I send them to government officials, just say so in your comment and I will redact your name. And if you want to share it with people who you think have great stories to tell, I would love for that to happen. I really want to hear the stories. If you've got success, like I said, I want to hear it too. I want to know that there's some good in this project, that it's not a total fiasco. That'll lift me up and lift up a lot of other people too, I think. So thanks for sticking with me this week. I know it's a little unusual, a little different for AWAP Wednesday. I'll be back at you next week with your questions, so keep sending them to me. I have a big long list, but I can always use more. If you like this video, please like it, share it with friends, tell everybody about it. Let me know what you think, and I will see you next week. Until we meet again, be AWAP. Beep. I will be back at you next. Schmutz.